Today we are going to be discussing about the diabetes mellitus. Diabetes mellitus is the metabolic disease, more appropriately a disorder of fuel metabolism. It is mainly characterized by the hyperglycemia that leads to several long-term complications. The normal blood sugar level is 70 to 110 milligram per deciliter. If the level of glucose is higher than the normal level, that condition is called as hyperglycemia. If the level of glucose is less than the normal level, it is called as the hypoglycemia. That is related to diabetes mellitus. Okay, diabetes mellitus is broadly classified into two groups. One, insulin-dependent diabetes mellitus, and second one is the non-insulin dependent diabetes mellitus. This classification is mainly based on the requirement of insulin for treatment. Insulin-dependent diabetes mellitus is otherwise known as type 1 diabetes mellitus, that is less frequently one, that is otherwise called as juvenile onset diabetes, which mainly occurs in the childhood, particularly between the age of 12 to 15 years age. Diabetes mellitus accounts for about 10 to 20% of the known population, and it is so-called diabetic. This disease is characterized by the almost total deficiency of insulin due to the destruction of beta cells of pancreas. The beta cells destruction may be caused by the drugs, viruses, or autoimmunity or autoimmune disorder. Non-insulin dependent diabetes mellitus is otherwise called as type 2 diabetes, that is also less frequent. This adult onset diabetes is most common, accounting for 80 to 90% of diabetic population. Non-insulin diabetes mellitus occurs in the adult, which is usually above 35 years and is less severe than insulin-dependent diabetes mellitus. The causative factor of non-insulin dependent diabetes mellitus, which includes genetic and environmental. These diabetes mellitus, which will be identified by doing several experiments. One is by the qualitative, another is by quantitative. First, we have to discuss about how the level of glucose is determined by using Benedict's test, that is a Benedict's qualitative test. Take 5 ml of the Benedict's qualitative reagent, which the composition of Benedict qualitative reagent is copper sulfate, sodium carbonate, and sodium citrate. This is added by 8 drops of reducing sugar sample, that is 0.5 ml of the sample, and boiled for 2 minutes in a dry test tube. And you can expect a color change, which is from blue to green, green to yellow, yellow to orange, orange to red, red to brick red. This color intensity is directly proportional to the concentration of the reducing sugar present in the given sample. This test is employed as a routine test for examination of urine for sugar. Reducing sugar is found in urine of diabetes mellitus as well as fructosuria, pentosuria, and lactosuria. This figure clearly illustrates the changes in the color, that is from blue to green, green to yellow, yellow to orange, orange to red. This brick red indicates that, and it is confirming the presence of high amount of reducing sugar that may be due to diabetes. So the mechanism of the reaction is sugar is converted to NADIol, that is oxidized to sugar acid. The other side, copper sulfate is reduced to cupric oxide. Copper sulfate to cupric oxide, that is Cu2 plus, that is the reduced one. The color intensity, if it is found green, that indicate that 1 plus, that is 0.1 to 0.5%, that is approximately sugar level. And yellow 2 plus, that is 0.5 to 1%. Orange 3 plus, that indicated 1 to 2%. Red is 4 plus, that is about 2. We have another method, that is quantitatively we can determine the amount of glucose by GOD-POD method, that is glucose oxidase peroxidase method. The principle is also been clearly illustrated here, that is glucose on oxidation by GOD from gluconic acid, then it is further oxidized to the and use a pink color. The color intensity we can estimate by using this colorimeter, and we can find out the exact level of glucose. That is, you take 3 test tubes. One is marked as blank, standard and test, and the reagents needed for this reaction will be added appropriately, and we can get the color. The color intensity is calculated by knowing the OD of the test, that is optical density of the test, and optical density of the standard, which is multiplied by 100 milligram per deciliter. Then we can find out the level of sugar. So another test is available to confirm the presence of glucose, and we can find out whether it's individually diabetic or not by doing a test that is called as GTT, that is glucose tolerance test. How we can do this glucose tolerance test is, first the patient is given 40 grams of glucose orally, and by the period of interval of 2.5 hours, that is 2.5 hours. Periodically, the urine and blood is taken, and it is estimated accordingly, and we will plot a graph. We will get a curve. Based on the curve, we can find out whether this individual is diabetic or not. The interpretation of GTT curve is the graphical representation of GTT result in the is shown in the figure. The fasting blood glucose level is 70 to 110 milligram per deciliter normal persons. On oral glucose load, the concentration increases and peak level 140 to 140 milligram per deciliter is reached is less than an hour, which returns to the normal by 2 hours. Glucose is not being detected in any of the urine sample. In individuals with impaired glucose tolerance, that is the fasting level is 110 to 126 milligram per deciliter, as well it is 2 hours, that is 140 to 200 milligram per deciliter. Of course, we have to know about the renal threshold also. The renal threshold of glucose is 170 milligram per deciliter. If this is excreted beyond this limit, that is 170 milligram, that condition is called as renal glycosuria. So in this condition, the plasma glucose level gets elevated. These subjects slowly develop diabetes, and is estimated to 2% per year. The elementary glycosuria, in certain individuals, the blood glucose level rises rapidly after a meal, resulting in its spill over into the urine. This condition is referred as elementary glycosuria. It is observed in some normal people and in patients of hepatic disease and hyperthyroidism and peptic ulcer. The metabolic changes in diabetes associated with the several metabolic alterations. The most important among them are hyperglycemia, ketoacidosis, and hypertriglyceridemia. That is, the level of lipid get elevated. That condition is called as hyperlipidemia. And if the level of glucose get elevated, this condition is called as hyperglycemia. If the ketone body level get elevated, that condition is called as ketoacidosis. The ketone body, which includes acetone, acetoacetate, and beta-hydroxybutyric acid. If the level of ketone bodies and glucose is elevated more than the normal ranges, this condition is called as diabetic ketoacidosis. What are the long-term effects of diabetes? Hyperglycemia is directly or indirectly associated with several complications. These include atherosclerosis, retinopathy, neuropathy, and nephropathy. The management of diabetes, which includes diet, exercise, drug, and finally insulin, is the management options of diabetes. Approximately about 50% of new cases of diabetes can be adequately controlled by the diet alone. 20 to 30% need oral hypoglycemic drugs, while the remaining 20 to 30% require insulin. That by providing proper, controlling the proper diet, by doing the proper exercise, and we can control the diabetes appropriately. Thank you.